Welcome to The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. In this episode, Dr. Sonal Choudhary and Physician Assistant Noel Prevost discuss the role that diet may play in athletes with acne, including an evidence-based discussion on protein powders. They also discuss the use of anabolic steroids and their effects on athletes' skin.
Hello, and thank you for joining us for our next episode of the Blend podcast. Today, we will be talking about diet and acne. So when diet clears acne with some integrative approaches to acne treatment. I'm joined today by another star physician assistant, Noel Prevost. So I have been wondering how to put this all together in terms of how diet really helps acne, and no better than Noel can help answer this question. We know that medications are not everything, and we have to look at a patient in an integrative, holistic manner. So I want to welcome Noel to this podcast today and let her introduce herself, and we'll begin with more questions. Hi, Noel.
Hi, my name is, again, Noel Prevost. I'm a physician assistant at the University of Pittsburgh Medical Center. I've been doing dermatology and focusing primarily on acne, probably for most of my career. I was appointed to run the Accutane clinic right when the iPledge program started. When I first started, it started as a SMART program, and then it became the iPledge program. So I have seen a lot of acne patients. I've seen a lot of trends, and with those trends, I now, as more and more research is coming out, I can back the trends that I've seen with data, which is really helpful. And since a young age, I've really loved nutrition. I felt that it definitely made a difference just overall how you feel based on what you eat, and also your performance in any kind of sports. I was an athlete for most of my life. And so as I got into basically my undergrad is athletic training, and then I ended up finishing my athletic training degree, minor in bio, and then I went into physician assistant studies. But during that time period, I did focus a lot on nutrition and on rehab for a lot of my athletes. And so that's kind of how I really got to get interested in nutrition and what it does on your, basically your mind, body, gut, things like that. So it's really, it's sparked a huge interest in me. And then when I met when Dr. Sonal Choudhary and I got together, we talked about nutrition. And then here we are kind of putting everything together from our clinical derm experience, and then, adding nutrition, which unfortunately a lot of providers are not really trained in. And I'm still getting trained in it. And it's been really helpful so far in my clinics.
Thank you, Noel. And I will keep up with that, point about your athletic training background, because, it is definitely something very strong in your portfolio that brings a lot to the table for your patients. Now, because you have that athletic training background, can you share how this has helped you to work with athletes and young patients who have had, like, say, severe acne or moderate acne? And if you can shed some light on what do you talk about protein powders, because that is very commonly used in that population of patients. I'm very curious about your take on whey protein.
So interesting question. So yeah, so when I see my acne patients, a lot of times I will kind of dive into their social history to see, are you a athlete? Are you a scholarship athlete, or just an athlete in general? Or do you, bodybuild, things like that? Because when you start finding out mostly about their social history and what they like to do, you'll start finding out that, yes, they start taking, they're taking whey protein, they're taking, different supplements to kind of enhance their performance. And so I like to kind of tease that out before I really dive into treatments, because it sometimes will kind of customize my treatment. Because a lot of times if I can modify their diet or change certain things, that can really impact the amount of acne lesions they get based on my clinical experience. And so a lot of times I do have the discussion, do you take whey protein? And the patients that do, I will have a conversation with them and ask them, like, have you noticed any changes since you've been taking the whey protein, things like that. And a lot of them have mentioned that, hey, actually, when they start looking back, they'll start saying, well, yeah, so I started about 2 months ago. And a lot of them, in my experience, are taking more than the recommended dosage, because I think in their mind, more is better. And so that is really increasing their acne lesions in the patients that I've seen. And so I do have that conversation, and a lot of times I will recommend, switching to a plant-based protein. But as I started doing the research, a lot of things started coming out. There's some case reports of whey protein, potentially worsening acne, and the issue is the sample size was pretty small in some of these case reports, so it's really hard to establish a cause and effect. But clinically, I have definitely seen worsening of acne in these patients.
I have as well. So I 100% agree with you. I see that connection all the time. And you mentioned about like plant-based proteins as being an option. I'll add to that. If the patient does not have any dietary or maybe like religious restrictions, I often will also recommend paleo protein powders. And these usually have like beef protein in them or egg protein or a combination of the two. What do you think about like, when people are trying to have these protein powders, sometimes there's added sugars or even other things like, dairy based like yogurt or something, and they have added sugars in them. What about sugar alternatives that patients can think of as better options, I guess?
So a lot of times you can do stevia or monk fruit. Those are some things that you can try to kind of sweeten some of the protein powders up with, because I don't know if you've ever tried protein powder or pea protein powder. It does not taste good, but it's something that you can think of with stevia or monk fruit, because I'm not aware of any of that. There's no research out there saying that any of that has increased risk for acne lesions.
Yeah, I would just add to that actually that I've definitely been following some of the research on this, and that stevia actually has neutral to actually some positive benefits on health overall. Monk fruit is mostly neutral, but I recently learned a little bit about that. It could be considered like a sugar alcohol, and can cause some, issues with it. But not everybody tolerates it as good. But stevia, if you can tolerate the taste and it doesn't bother you, then that's definitely a decent one. What are your sort of key things that you talk about? Because we talked about athletes and acne, right? So is there a discussion point ever regarding anabolic steroids with them, if they are taking it, or you've seen any associations with acne that we already are like known from literature?
Yeah, so we all know, or at least most of us know, that anabolic steroids can definitely increase your risk for acne. There was a study out in 2019, a retrospective matched cohort study by Hurwitz et al. There were about 545 male subjects who tested positive for anabolic steroids. And their prevalence of acne was found to be significantly higher in the users versus matched controls. So, there's definitely studies out there, and that's just like one of them that definitely shows that it can increase your risk. And so, yes, this is definitely a conversation I have. So obviously it's the appearance of the patient. So a lot of my patients, when they come in, if they're on anabolic steroids, it is quite obvious. So that would be probably my first question to them if they're complaining of acne. I say, are you taking any steroids, anabolic steroids? And a lot of times they do cycles. So they'll get in, there's different things. There's like Anavar, there's different things in that world that they are taking that's giving them that physique. And so once I have that conversation with them and they are, and obviously I approach it in a very sensitive way so that they're more open with me, because I feel like establishing a good rapport and then getting more information is definitely going to help you in treating them. So I do talk about, hey, if you are taking anabolic steroids, regardless of what I give you, whether it's systemic antibiotics, whether it's Accutane, they're still going to break through. So that's something to consider. And in fact, a couple of my patients recently developed a severe acne fulminans with the anabolic steroids. And so this is really can be very concerning when they're on the anabolic steroids and they develop acne fulminans, because it's like a systemic reaction. And then it's like an automatic isotretinoin treatment, and it's a very low dose. We have to watch their kidneys and things like that. So, once we have these conversations, a lot of times they will try to stop it. Sometimes, unfortunately, they are almost like addicted to them. So it's hard for them to get off of it. But sometimes the acne is so painful, like in this one particular patient, he wanted to stop immediately. And it's really shocking the difference of their body figure after stopping anabolic steroids and seeing like literally their muscles shrink down. His acne, unfortunately, once he stopped, was obviously still there and did not significantly improve. It got better, but it was not, he was still in pain and still developing large cystic nodules. So yeah, that is definitely a conversation I have, and I try to convince them to stop the anabolic steroids.
We hope you enjoyed this episode of The Blend. Thank you for listening. We'll see you back next time.